I'd just like to start with defining so that we are all on the same page about what interventional pain management is and interventional pain management techniques are, and you could read that. The main thing which we have to understanding is the field is ever-changing. As science, exponentially, the knowledge of science increase day by day, especially our interventional pain management, the way we practice, the way we understand the basic mechanisms changing day by day as well too, even though we have still a long way to go to learn a lot of things, what we do, why we do it, and how we do it, and what else we should be doing. So it's an evolving field overall. So that's one of the reasons why we have to come to this type of meetings so that we communicate with each other